For more detailed information than the warning label gives, you can turn to the chemical's Material Safety Data Sheet, or MSDS. Chemical suppliers must provide an MSDS on every hazardous chemical they ship into your workplace. Your employer then makes sure that the MSDS for every chemical you work with is available to you. MSDSs may be kept in a binder, a file cabinet, or on a computer terminal, as long as you can gain access to them in your work area during working hours. The MSDS you work with comes in a variety of lengths and formats. They all contain basically the same vital information, but it may be organized in various ways. It's always a good practice to be familiar with the MSDS for any chemical you work with before a problem arises. That way, you are prepared to react to an emergency. First of all, the MSDS gives you the name of the chemical, the same name that is on the product's container. It also lists the name, address, and phone number of the manufacturer in case you have general questions about the chemical, as well as a phone number to call in an emergency. If you have two MSDSs for the same chemical, use the one with the most complete information. Also check the date the MSDS was last revised. This tells you how up-to-date the MSDS is. The MSDS must identify the substance by its chemical name and any common names. This is usually done in the first section of the form. For instance, formaldehyde, which is used in hospital labs to preserve surgical specimens, is also listed as formalin on its MSDS. If the chemical's identity is a trade secret, the manufacturer can withhold this information. But the manufacturer must still provide full information on the chemical's hazards and how to control them. A second section lists hazardous ingredients of the chemical that can harm you. It also gives the concentration of the chemical to which you can be safely exposed. Look for key terms like permissible exposure limits, PELs, or threshold limit value, TLVs, the maximum concentrations of the substance that most are allowed to be exposed to, averaged over an 8-hour work shift. A third section describes physical data that can help you identify the chemical, such as its appearance and odor, as well as other characteristics like boiling point, melting point, vapor pressure, vapor density, solubility in water, and evaporation rate. For example, formaldehyde is described on the MSDS as a clear, colorless liquid with a pungent odor, while chloroform, another lab chemical, is described as a clear, colorless, volatile liquid with a sweet, pleasant odor. A fourth section informs you of any severe immediate hazards, such as when the chemical might ignite or explode. Look for the flash point, or temperature at which the chemical ignites. For flammables, this is below 100 degrees Fahrenheit. For combustibles, the flash point is 100 degrees Fahrenheit or above. Here you'll also find out what to put on the fire to extinguish it safely. Another section lists health hazards caused by the chemical, including the symptoms of overexposure and medical conditions that may be aggravated by exposure. For adriamycin, an anti-cancer drug, the MSDS states that acute overexposure can cause eye, skin, and respiratory irritation, while chronic exposure can also cause changes in skin pigmentation. In addition, adriamycin itself can cause cancer, and it may aggravate pre-existing medical conditions, such as cardiovascular, liver or kidney disease, and bone marrow impairment. This section also gives first aid and emergency procedures. For example, adriamycin's MSDS recommends washing with soap and water immediately if it comes in contact with your skin. A section on reactivity informs you of whether the chemical is stable or unstable, conditions to avoid, as well as its incompatibility with other materials. Another section tells how to clean up accidental spills or leaks, and may tell how to dispose of the chemical. For example, to clean a spill of ethylene oxide, the MSDS says to wear a self-contained breathing apparatus and full protective clothing. In many instances, commercially packaged emergency response kits are available to clean up spills of blood and other hazardous substances, including some chemicals. It's always a good idea to notify your supervisor of any chemical spill right away. And make sure you're trained and wearing the appropriate protective gear before you attempt to clean it up. The section on special protection lists any personal protective equipment you'll need to work safely with the chemical, such as a flow hood, respirator mask, splash goggles, latex gloves, and a long-sleeved impermeable disposable gown you'll need if you work with adriamycin, according to its MSDS. Full protective gear, as well as an air-supplied positive pressure respirator, are also MSDS recommendations when you must change bottles of ethylene oxide. And even common cleaning products can require you to use personal protective equipment. For example, this chemical cleans and disinfects hospital shower stalls, making the environment safe for patients. But when you follow the MSDS by wearing gloves and goggles, you help keep yourself safe as well. A final section lists additional special precautions to follow when handling the chemical. This may include what you should have on hand to clean up a spill or extinguish a fire, as well as other health and safety information.